So friends, many of you asked for a video on elbow pain. So in today's video, I'm going to address your problem and I'm going to talk about elbow pain. Commonest form of elbow pain is tennis elbow, but there are many other conditions or a situation that lead to elbow pain experience. That's why if you are having elbow pain, the first thing that you should do is see a doctor in order to identify why you are having elbow pain. But let me tell you about some common conditions that leads to elbow pain. The most commonest one is tennis elbow, which is now a very general term, and you must have heard about this term some point in your lifetime. Apart from that, golfer elbow is also a very common problem that leads to experience of elbow pain. Even if you have got osteoarthritis of the elbow joint, then also you might experience elbow pain. Sometimes patients who have got spondylitis can show the signs of elbow pain. Even shoulder arthritis, frozen shoulder, bicipital tendinitis are certain conditions which leads or else mimics the condition as of tennis elbow, and patient will complain of elbow pain. Even if you are having some sort of fracture of arm, at that time you might complain of elbow pain. In neurological scenario, if you are having spasticity of hand muscles, at that time this spasticity can lead to experience of elbow pain. Other conditions like reflex sympathetic dystrophy, peripheral nerve injury like wrist drop, stroke, Parkinson's disease are certain situations which can lead to experience of elbow pain in patient. But in today's video, I'm going to address about tennis elbow, the most commonest form of condition that leads to experience of elbow pain in many of us. So what is tennis elbow? Why it happens and how it is managed? We are going to talk about it in this video. So let's have a look. Tennis elbow in medical terms is also called as lateral epicondylitis, which means the pain that is present on the outer side of the elbow if your hand is kept straight. Mostly lateral epicondylitis or else tennis elbow is caused due to overuse injury, which means repeated movement that is happening over and over again. The injury that happens here is on the muscles and the tendons that surrounds the elbow joint and forms the muscle of the forearm region. These muscles are also called as extensor muscles of the forearm, or else the muscles which are responsible for our wrist extension, or else our ability to raise the wrist upwards. Mostly there is inflammation as well as sometimes micro tearing in the tendons and the muscles that are surrounding the elbow region, due to which a patient will complain of pain. The reason why a person gets tennis elbow is mostly due to overuse, which means doing one activity for a repeated amount of time. This is mostly an occupational problem. That's why people who play tennis, teachers who have to do a lot of writing work, or else desk worker where there's a lot of wrist movements involved, they will have higher chances of getting tennis elbow compared to people who have got sedentary lifestyle, or else who do not use their hands that often. Even activities that involves movement of wrist that is repeated, even they will lead to experience of tennis elbow. Mostly people between the age of 30 to 50 are at higher chances of developing tennis elbow, and sometimes the cause of tennis elbow stays unknown, which means the tennis elbow can even happen with someone who do not have all these factors or else all this history present, still they will develop tennis elbow episode. Now, what are the symptoms of tennis elbow? The first symptom that a patient with tennis elbow complains of is elbow pain, very obviously. Pain that is especially located on the outer side of the elbow, somewhere here, and this pain is aggravated while doing wrist movement, especially while raising the wrist upwards. Tennis elbow also leads to weak grip strength, which means the patient loses the power of holding something, or else patient experiences that their grip has reduced, that their grip strength has reduced, and they are not able to hold the things tightly. Gradually, as the condition worsens, the problem also worsens and patient starts complain of pain even while doing forearm activity like moving the hand inside and outside. And the dominant arm, or is the arm that we use most often, mostly which is right side, is more affected compared to the left side. Now, how you can know at home whether you have got tennis elbow or not? Mostly, if you are having pain that is located on the outer side of your elbow region, and if this pain kind of increases when you kind of raise your wrist upwards and then raise your finger upwards, and if your pain increases with this movement here, that means you are having tennis elbow. Even when you apply pressure in this region, if you complain of pain, that means you are at a risk, or else you are at a higher chance of developing tennis elbow. And this is the time when you should see the doctor in order to identify the severity as well as some internal pathology is present or not, in order to rule out some other conditions as well. When you go to a doctor, the doctor mostly will ask for your history, will do physical examination, they'll do some physical diagnostic test. At the same time, some tests like X-ray and MRI would be prescribed to rule out some other problems which could mimic tennis elbow situation. Basis that, the treatment is given. Mostly, the treatment of tennis elbow is done with the help of medication and physiotherapy. Medicines usually involves painkillers as well as anti-inflammatory medications, and physiotherapy incorporates RICE regime, which means giving rest to the area with the help of avoiding activities of the affected hand, applying ice massage 2 to 3 times in a day in order to reduce the inflammation as well as swelling in that area, compressing or giving support to the region with the help of elbow straps or as elbow belt, and sometimes if the pain is too much, electrical modalities like ultrasound or TENS or IFT is used in order to reduce the symptoms of pain. Once the patient starts showing the signs of healing, then exercise therapy is started. Mostly when the patient is in pain, exercises are kept very gentle, which are gentle range of motion exercises again, but no other harsh strengthening or stretching exercises as given during this point of time. Even sometimes physio might recommend doing some massage on the affected muscular area which are tight in order to prevent knot formation or else tightness development. But once the patient is out of pain, it's important to do right strengthening exercise program and doing lifestyle modification in order to prevent repetition or else the second episode of tennis elbow. If patient is not showing any signs of recovery with this conservative management, then surgical management is used, or else medical management which incorporates injection of steroid is being used. But the prognosis of tennis elbow is really good and patient very nicely recovers only with the help of physiotherapy and certain medication. Hence, if you are experiencing elbow pain, don't worry, you would be absolutely fine as this problem is very easily manageable. I hope through this video, I was able to solve a lot of confusion of you related to elbow pain. If yes, make sure to like this video, share this video, and don't forget to subscribe to HealthQ channel. I'll see you in another video. Thank you.